meaningfully participate and use their voice in the criminal justice process. And whereas victim service providers, advocates, law enforcement officers, attorneys, and other allied professionals can help survivors find their justice by enforcing these rights. And whereas the right to provide an impact statement ensures that victims' voices are considered in the court during the sentencing and, when applicable, restitution processes. And whereas including and elevating the voices of survivors makes certain that they are heard and seen and creates a path to forging and sustaining community trust. And whereas engaging survivors creates responses and services that are credible, meaningful, and centered on individual needs. And whereas survivors' lived experiences can serve as a catalyst for implementing innovative programs, shifting existing programs in new directions, and changing policies or practices that prevent survivors from accessing services or pursuing justice. And whereas the National Crime Victims' Rights Week provides an opportunity to recommit to listening to crime survivors in every space where decisions are made that could impact them. And whereas the Pike County Commissioners are hereby dedicated to amplifying the voices of survivors and creating an environment where survivors have the confidence that they will be heard, believed, and supported. Now, therefore, we, the Pike County Commissioners, do hereby proclaim the week of April 23 to 29, 2023 as Crime Victims' Rights Week, reaffirming Pike County's commitment to create a victim service and criminal justice response that assists all victims of crime during Crime Victims' Rights Week and throughout the year, and expressing our sincere gratitude and appreciation to those community members, victim service providers, and criminal justice professionals who are committed to improving our responses to all victims of crime so that they may find relevant assistance, support, justice, and peace.
Thank you, Tony. Sarah, would you like to speak to this? Sarah's from the CAC.
So I just wanted to say, everyone likes to be heard. Everyone loves to know that somebody is listening to them. And I think as crime victims or survivors, they like to know that somebody's listening to them. So like as Chelsea said, and as VIP does, they help make those victims and those survivors have that voice. And so Crime Victims Week, we really want to remember that some people don't get to have that voice. Some people never want to use that voice, and we really want to empower people to make sure that they feel confident and empowered to use their voice as much as they can. So just want to say thank you to VIP for helping the victims that our office sends over there, and thank you guys for all your support. So, thank you.
Thank you, Sarah. Thank you for what you do. We have a motion to execute the purchase of service agreement between Casavant Memorial Homes and the County of Pike on behalf of the Children Youth Services.
Thank you, everyone.
Thank you all.
Thank you.
Keep up the good work. Have a motion.
Motion.
And second.
Motion and second. Any questions? All in favor?
Aye.
Motion to authorize the chairman to execute the letter of amendment to the Shalola Falls Road Bridge project.
Motion.
And second.
Motion and second. All in favor?
Aye.
Motion to execute the Intermediate Punishment Treatment Program grant application on behalf of the Probation Department.
Motion.
Second.
Motion is second. All in favor?
Aye.
Motion to approve the following human service payment vouchers on behalf of the Office of Human Services State Food Purchase Program in the amount of $5,933.91. Human Services Development Fund in the amount of $1,695.87. Emergency Rental Assistance Program 2.0 in the amount of $110,506.87.
Motion.
And second.
Motion is second. Questions? All in favor?
Aye.
Motion to approve the Community Development Block Grant Payment Voucher in the amount of $58.75 payable to the Recorder of Deeds for Vargas Lien on behalf of the Office of Human Services.
Motion.
And second.
Motion is second. Questions? All in favor?
Aye.
Motion to approve the Community Development Block Grant Payment Voucher in the amount of $7,916 payable to Pro Solutions Home Renovations LLC for Vargas upfront payment on behalf of the Office of Human Services.
Motion.
And second.
Second, all in favor?
Aye.
Motion to approve the Community Development Block Grant Payment Voucher in the amount of $6,355.22 payable to the Family Promise on behalf of the Office of Human Services.
Motion.
And second.
Motion is second, all in favor?
Aye.
Motion to approve the Community Development Block Grant Payment Voucher in the amount of $710 payable to the Amazing Place LLC on behalf of the Office of Human Services.
Motion.
Second. Motion is second. All in favor?
Aye.
Motion to approve the contract for professional services agreement for fiscal year 23-24, effective July 1st, 2023 through June 30th, 2024, on behalf of the Children and Youth Services.
Motion.
Second. Motion is second. All in favor?
Aye.
Motion to approve the purchase of service agreement for fiscal year 2023-24, effective July 1st, 2023 through June 30th, 2024, on behalf of the Children and Youth Services.
Motion.
Second. Motion is second. Any questions? All in favor?
Aye.
Motion to approve the business associates agreement for fiscal year 23-24, effective July 1st, 2023 through June 30th, 2024, on behalf of Children and Youth Services.
Motion.
Second. Motion is second. Any questions? All in favor?
Aye.
Motion to recommend the reappointment of Cynthia DeFabo to the Board of Directors of NEPA Alliance for the new fiscal year commencing July 1st, 2023.
Motion.
Second. Motion is second. Any questions? All in favor?
Aye.
Motion to recommend the appointment of Antonio Perito to the Board of Directors of the NEPA Alliance for the new fiscal year commencing July 1st, 2023.
Motion.
Second. Motion is second. All in favor?
Aye.
Motion to authorize the fiscal year 2023 first quarter payment of Pike County Emergency Medical Service Matching Grant Funds to Palmyra Township in the amount of $44,500.
Motion.
Second. Motion is second. Any questions? All in favor?
Aye.
Before we go to miscellaneous, so in the packet here, you will see that we're continuing with the funding for the medical services. You'll see that last week's meeting, we awarded money to Delaware Township, Lackawaxen Township, Milford Township, Porter Township, and Chohola Township. So all of this money is being equally distributed among the county, obviously where the millage is laid out. But you know, it's a continual effort here. I know, I'll just say it, I know at the last meeting we took a couple of shots about this. And we shouldn't be taking shots about this. This is a really positive program that's going on in this county. And I'll just say we have some members of Lehman Township here. I think if you saw today's dispatch, I know it came out late last night, so many of you haven't seen it. But I think it's exciting news of what's going on in Lehman when it comes to their ambulance services now and what is problemating, that's the word, with an urgent care service that's down there. And I think this is all being driven by the partnership between the county commissioners and in this case, the Lehman Township supervisors. And I just think it's being, you know, made out to be something that's not real. It is real. And I don't know if Lehman wants to speak a little bit to this, but I think it's important that we hear from the township officials.
Our EMS administrator, Sue Duffy, would like to make a statement.
Sure.
Great.
You can do it from there or wherever you want, whatever makes you comfortable.
Oh, come on up here.
Oh, come on up, let's see
Come
you.
on up.
I want you on TV.
Yeah.
Because again, back to the article that's in the paper is very uplifting.
I'm hoping, the byline scares the heck out of me because the one thing that I said to him is please understand that by my talking to the liaison at Lehigh Valley Health Network, there are no talks about any sort of building whatsoever. All they are is seeing us. And so I didn't read the article yet.
But it's the
because
beginning.
got it. Yes.
It's the beginning.
And you will forgive me because like the wonderful people that spoke here today, I have to stick to this because I'm not a public speaker and I have to speak from what my head told me instead of what my heart might want to have said in response to those things that were, okay.
We had to peel her off the ceiling.
You did, and I had to peel my people off the ceiling as well. So I am the EMS administrator, as you heard, for Lehman Township, or Lehman Pike EMS. Between the time that we started last year, March 9th, and yesterday, we have responded to a total of 1,507 dispatches, which I think is pretty amazing. More than 50% of those calls were advanced in nature, and each month those percentages are increasing where we need paramedics. For those who don't understand the difference between basic life support and advanced, basic life support basically is the cornerstone. They're the glue that holds EMS together. That is your emergency medical technicians or EMTs, your emergency responders. They provide all of the basics that we need for breathing, circulation, bandaging. They're the guys that go out there and start everything, and nothing that we do, even as advanced providers, is worth anything without those EMTs. Advanced life support now is kind of like an emergency room on wheels. There are advances where we can transmit EKGs directly to the hospital if we feel that someone is having a heart attack, or if we see that someone is having a heart attack, so that the cardiac catheterization team will be ready at the door waiting to take that patient up to the cath lab. For stroke alerts, they will be waiting for the CAT scanner to put that patient in. So we are able to get that information to them and also treat them before they ever would be able to if they had to wait and drive themselves to the hospital. Our people are, in moving vehicles, they do it 24 hours a day as well. We are, I'm sorry.
Okay.
There was a statement, I believe, that BLS units are nothing more than hearses. That is not only disrespectful, it's ignorant, it's blatantly false. We are no longer in the era of throwing patients in the back of a Cadillac, driving really fast to the hospital and hoping they arrive alive. Up until recently, I was actively working in advanced life support. The advancement that EMS has seen over the years is quite astounding, and while there will always be room for updates regarding technology, protocols, it's something to be quite proud of. We see the balance of our patients who would never have survived in those previous eras, not only arriving at the hospital alive and frequently greatly improved, but they're also walking out of the hospitals and they're continuing with their lives. The emergency medical services in Pike County, of which there are roughly 13 services, I believe, they cover approximately 550 square miles with a population of just under around 60,000 people. Many of those services do not have advanced life support. They are not available 24 hours a day. That puts a lot greater wear on those services that are running 24 hours a day than they had planned for. Lehman Township is extremely lucky. We're one of the only services in the area that is an actual department of our municipality. Most services began as private volunteer organizations. Many still are. I say we're lucky because we're set up primarily to cover Lehman Township and small portions of Middle Smithfield and Porter. We will always handle mutual aid calls for any neighboring area that needs us. But there are services in Pike County who actually cover a huge section of Pike as well as portions of Wayne, the whole sector of Route 84, and they actually go into New York State, and they do it with one ALS unit. That's a lot of wear and tear. Which brings me to my next false statement that I heard, is that response times do not matter. The American Heart Association states, and I quote, "We report decreasing survival as ambulance response time increases." This is an association with cardiac arrest, with traumas, with strokes, and it is specifically observed in pediatrics. By rapid response time, we're not referring to driving ambulances at breakneck speed to get to the destination. That only jeopardizes your crews and your general public. We need to provide our services with the appropriate funds and or equipment so that they're not required to travel great distances to these 911 emergencies. As you all read in the dispatch, I recently spoke with the EMS liaison at Lehigh Valley Pocono. It was mentioned that Lehigh Valley is impressed at the number of responses that Lehman Pike has had since we have began taking 911 calls. They are likewise impressed with the number of responses in Delaware and Lackawaxen Township. They are finally actually seeing Pike County. We always knew that it was a busy 911 area. I'm glad that others are truly seeing it now as well. Services can only hope to provide adequate personnel, equipment, vehicles, or stations based solely on, based solely on reimbursements from insurance. I can't speak for other areas. In Lehman Township, the vast majority of the insurance coverage for our residents is Medicaid or Medicare, which covers roughly about 23% of our bills. That's if they pay them at all. A large number of our patients still have no insurance, or they have private insurance who sends them the check and they just don't happen to pass it along to the, and then we have to try to figure out a way to get it. So, trucks and equipment are very expensive. They require constant upkeep. Payroll is a huge burden. Workers' compensation for EMS is exorbitant. One time someone said to me that it is akin to working with dynamite. So the workers with dynamite have roughly the same workers' comp as an EMS worker. Many supplies are not provided by the hospitals, and oftentimes, due to vast shortages, are difficult to obtain from outside vendors. EMS personnel generally work 2, 3, or more different services just to be able to make ends meet. They work long shifts, they work days, nights, holidays. They aren't able to spend any significant time with their families because they are providing a necessary service to the general public. Most services do not provide paid time off or benefits of any kind, but these providers work in EMS because it is something that they love and it is something that the communities cannot do without. I will reiterate for anyone who sits there and states that EMS providers are no better than hearse drivers or that rapid response is unnecessary. They do a great disservice not only to those who work in emergency medical services, but to the communities they serve. And I guarantee that if anyone in this room had a loved one who was in the midst of a medical or traumatic emergency, time would be of the utmost importance. And I hope that every EMS provider who walked through their doors would be held in its highest regard because they absolutely deserve to be. And thank you for your time.
Let me go first because this is a passion of mine. And the one thing I forbid you from ever saying again is that you're not a good public speaker. You are passionate. It comes right through. Lehman and the entire county is lucky to have a person like you in such a leadership role. When we jumped into this game, after meeting after meeting after meeting, if you heard last meeting, I went on about this, there wasn't an answer because the system was there. It wasn't broken, it was broke. And that's why some people have said it was overreach on our part to reach into the municipalities to offer financial support. We didn't want to run it. We didn't want to be involved with it, but we wanted to provide you with a way of helping to fund it. I do believe my businesses are in Lackawaxen Township, and what I knew then was Lackawaxen had figured it out a little bit by passing a referendum, by having a full-time paid staff, by putting money into it, because it's a community. Woodlock Springs essentially is that pulse of that area, people moving from New York expecting high level of services, but successful people that could afford both in time and financial to get involved. And I do know that that your supervisors looked at Lackawaxen as a model to build the current system that you have. The leadership in Lehman should be commended. It wasn't in this shape not that long ago, and you couldn't be up here today saying that you made 1,500 plus calls, but now you can, and it's just exceptional work. So congratulations. We love to be partners with Lehman and all of the 13 municipalities. And as long as we're here, that will continue as vibrantly as it is now and into the future. So thank you.
Thank you.
Yeah, it is. It's extreme. You know, you talk about mutual aid. I mean, that's why we went into this, was because we know that there was difficulties, particularly with the smaller municipalities. It's not that they didn't want to do it. They didn't have the ability to do it. So, you know, I've used this at other discussions. It's like the haves and the have-nots. They didn't create the boundaries of their municipalities. They didn't create how many parcels they have in it, but they still have to provide the same service. So the money that we felt that we put into this would also kind of somewhat level the playing field, because obviously, you know, the bigger townships get more, but, you know, it is important because we're all sitting here in Milford Borough right now, and if one of us had a medical emergency, regardless of where we live in the county or where we live, we're anticipating that there's going to be ample ambulance services that are gonna come here. Whether it's ALS or BLS, as Ron said at the last meeting, we know we can do better, and we will. But this was the beginning of this. You're right, we need probably more ALS units in this county. But we need to figure that out as a team, right? All the municipalities need to work together. The county's here to help foster this along, but then it's also the municipal leaders that have to come together. Dingman Township, I know, talked about what they were going to do when we started funding this. They felt it was more important that they bolster their BLS unit. Right?
They're doing a wonderful job.
They are, right, and everybody in Milford Borough in this region of Pike County is benefiting from that. Lackawaxen did the same thing by moving another rig into the Greeley location, which didn't have an ambulance in it. Well, that benefits Shahola. Shahola's putting one into Walker Lake. This is all together, but I'm just gonna say this, to come here and criticize this is really being ignorant. We wouldn't have Lehigh Valley coming here and talking to you, whether the article is accurate or whatever, but more importantly, they're here talking to you because they see the numbers. We met with Lehigh last year, and we brought them back then, it was only 6 months of calls, and showed them the county calls, and you could see their eyes open.
They were impressed.
Because now they're impressed, and on that note, and that's why Northwell is interested in here. So, we'll just tell you this, that last night at the Delaware Township Planning Commission meeting, they got their conditional use approval from planning, and now it goes on to the supervisors. So that's moving, what happens in Lehman, or whether it's in Lehman or right across the border, I don't know, again, I only read the article, that's all important. This is all of us working together, like I say, it's ignorant to think this isn't working. So thank you for what you do. And thank you for you. Go ahead, Terry.
Well, I have to thank the commissioners so much for what they helped us with. And like she was saying, time does matter. We had people, literally laying in their driveways, waiting for an ambulance for 45 minutes. And that's a story you're hearing more than once. And that was what was going on before you guys and Sue and all of us got together and put this together. And it's just been a big difference. And people do call on the phone and thank us. And they're so happy. And that's what's important. And they're getting service.
We haven't heard anybody complain to us about
Nobody
money
has,
we put into it.
yeah, nobody has complained.
Because the average payment is something like whatever, $70 a year for a household county taxes I'm talking about, right? I don't know about you, but if I'm laying on the floor waiting for an ambulance, I'll be waving $70 in there pretty quick.
And I'd just like to add, to follow up actually on something that Ron said. I was a solicitor for various municipalities in Pike and Wayne for over 40 years. And the system wasn't broken, it just needed the financing. And the reality is that there were some haves, Lackawaxen being one. I represented Palmyra Township for over 3 decades, and they were able to form a unit, but they could barely fund it, because they were also, because they did have that there, 40% of their calls were outside the township. So that have and have nots thing became an issue. But the reality is that, there was a suggestion made by people running for office that, well, maybe we just need a different system, an authority bureaucracy. We don't need more bureaucracy. We just need to fund the existing situations. And fortunately, my colleague sitting here and my predecessor, Steve Buccini, had the courage to say, you know what, we're going to make sure that happens. And not just use federal dollars, but to use committed funds so that they can be there, hopefully forever. As long as the right people are sitting at this table, hopefully that'll happen forever, because it's worked. And you're giving concrete examples of how that works. And the people that, maybe they speak in ignorance, otherwise it's deliberate misstatements. That's a fancy word for lies. And we can't have that, okay? We gotta make sure people understand when something's working, you shouldn't mess with it. And fortunately, this has been working in the last year or two. I'm really glad that it is working for you particularly. Thanks.
Thank you. Thank you.
Where were you last week?
Well, I'm disappointed.
Yeah, I know.
It's a good thing I
We were
was
looking for an opportunity, maybe.
I think they heard your comment.
So we'll just go ahead, miscellaneous here. Penn State Extension every month is on here. I think it's important that we, for the press, listening in the press here, mental health first aid for adults dealing with children. There's a great program they're putting on. And also this ties into what we're just talking about, the 4-H Future First Responders camp that goes on this summer. We want as many people as we can to participate in that, because it's important that we educate the youth up there and go to the trainings. Me and Ron yesterday were at the Delaware Township training for extrication of a vehicle, and I am just in awe of the work that those men and women do, and the equipment that they have to deal with.
And they let us play with it.
And they let us play with it, yeah.
That's the best part.
Yeah. So next we go to press and public comment. Anyone else? You're the press there. You got nothing.
You good?
Got nothing. All right, so if that's everything, we have a motion to adjourn.
Motion to adjourn?
Second.
Okay, motion and second. Thank you, everyone.